Okay, so today we'll start with bronchial asthma. So, what is bronchial asthma? Bronchial, again, the word only defines that it is in the bronchi only, because whole the whole respiratory system is involves that only bronchi, bronchus, trachea, and all. So the everything, because main lungs part is here only, inside it the bronchi and alveoli is there. So therefore, it involves this only. Other respiratory disorders are also there, as I told, emphysema, that is not in our syllabus, but which involves alveoli and all. But whatever is this, so again with the name of bronchial, bronchi, it means that it is happening in the bronchus. It is also the similar, because everything happening in bronchus, and problem with bronchus is that only that there is blockages in it. So the similar disease, but a little difference we'll see. Definition. So conditions characterized by recurrent attacks of a difficulty in exhalation due to the reversible narrowing of the airways in the lungs. So what happens, as the airways is narrowing down, there is a, like a, in this in a, what is this bronchial asthma and normal asthma, what we used to call in daily life, are the same only. Okay, we used to call it bronchial asthma because it is happening inside the bronchus. Therefore, otherwise, in normal language, it is called as asthma. Okay, so in what happens in this, the recurrent attacks are there. Okay, like asthmatic attacks we used to call in normal life. No? Asthmatic attack is the person is having. So recurrent attacks are there, and there is difficulty to inhale. It's feeling difficulty to inhale by reversible again.
Exhale, right, man. It's exhale. Difficulty in exhalation.
In exhalation and inhalation, because of course if there is blockage, exhalation and inhalation, everything will hinders. Hmm. So due to reversible narrowing down of the passage, air passages narrowing down. So we'll go further. So what happening exactly? So the question can come that in like yesterday disease also narrowing down of the passage only, in this also narrowing down of the passage only. So I'll tell you. Yesterday we did chronic bronchitis. In chronic bronchitis, also the narrowing down of passages there. But in this, the difference in bronchial asthma, and that is here approximately the complete blockage or very less space is there. That's why the person feel very difficult to inhale, and due to that much severity is there, that person will get attacks because not able to exhale or inhale properly. Okay, bronchial asthma is a lung disease. Airways get narrowed down and swollen or blocked completely. Blockage is there. Or excess mucus is there, by excess mucus. Okay, asthma also called as bronchial asthma. I said you before only that asthma is the same as bronchial asthma. It affects our lungs, and it is chronic and it's ongoing. It remains for long period of time. Maybe if untreated in starting stages, maybe it will on go up till the end of the life. Okay, meaning it doesn't go away and needs ongoing medical management. But in yogic management, if we give them the yogic management, we'll see ahead what will give them. So then the person can get a little relief from the problem. Okay, so in this you can see the normal airway. This one is normal airway. This is bronchial asthma, where very less space. Yesterday was also there is blockage, but very less space. Approximately no space was there for the air to come out or exhale out or inhale in. Okay, like that. Okay, so this is nothing but a little data that 25 millions of people in US are currently having asthma, out of which 5 millions are children. Asthma is life threatening because I said you it could go up till the whole life, and can even leads to death. Why? Because the attack, and if the asthmatic attack will come, the person is unable to breathe in, and without breath nothing is there. So when the breath, no, when the person normally breathe, are what happens, are these are bronchi, bronchus, okay, bronchioles. So these are relaxed when it is said that when we breathe normally, the muscle around your airways are relaxed, but letting air to move easily and quietly. When asthma attack is there, they get thickened. Okay, three things happens. Usually they get thickened or some inflammation and mucus. That will see what we call the as the term in terms what we call them. So bronchospasm. Bronchospasm, what is the meaning of bronchospasm? It means that if in these bronchus the tightening or constriction means a little tightening of the walls happens. This is called as bronchial asthma. Okay, as you know that if something is tight, it will definitely going to be a little narrowed down as it before. So it will hinders the free flow of the air, and it will be difficult for the person to exhale out or inhale in. Again, the same how inflammation also, as yesterday only I make you understand very clearly that how inflammation will hinders the exhalation and inhalation. Okay, everyone remembers the passage will here, as yesterday someone was saying that the walls are shrinking. Walls are not shrinking. Due to the inflammation, the passage of air to travel is narrowing down. But in a bronchospasm, the tightening of the walls are happening. Due to the tightening of the walls, it leads to narrowing down again. And then mucus production, if more mucus will be there in the bronchus, then it will further leads to again narrowing down of the passage and can create the problem. Okay, during the attack your body creates more mucus. This thick mucus close the airways and make it difficult. This slide is clear. This one, first one. Any problem? What is bronchial asthma? Are you all there?
Yes, ma'am.
Okay, clear. Any
Yes,
doubt
ma'am.
up till now? No. So we'll now move
Ma'am,
towards.
ma'am,
Yes,
hello.
yes,
What
sir.
is the what is the difference between bronchial asthma and bronchitis or COPD? They are similar. I
Sir,
just think
what
this
is
is
COPD? Tell me. Yesterday I told na, what is COPD?
COPD is a mainly obstruction in the airways.
Obstruction in the airways is in all the respiratory disorders maximum. But what exactly the COPD? COPD is a single disease. I told. Okay, mute yourself. Mute yourself. I told you yesterday also COPD is not a single one disease. It is a group of disease which involves emphysema and chronic bronchitis both together. Okay. So both together. So emphysema, I told you in extra, it is not in our syllabus, but still that emphysema is affecting our and alveoli, alveoli, and your this chronic bronchitis is affecting your bronchus. And now you are asking that what are the difference between chronic bronchitis and this one bronchial asthma. And you are asking how COPD. COPD is nothing but bronchial, this chronic bronchitis comes under the COPD. One of the disease which comes under COPD. What is emphysema? Emphysema is in alveolar part. Now next this asthma. Asthma is similar to in bronchitis. In starting only I said you, but in this the blockage is more as compared to chronic bronchitis, or the complete blockage is there due to which the it is hindering such that the person is unable to exhale out properly or inhale in properly. And this like inability of inhaling and exhaling creating the attacks. The person usually get attacks. We used to say na asthma attack and all. You understand now the difference, complete blockage or the very less space that person is unable to exhale or inhale. In that, difficulty in exhaling and inhaling. But here, no exhalation and inhalation possible at some times. That sometimes are the mm, that sometimes are the condition when the person get attacks. You understand now?
Yes, ma'am. I understand.
Okay, now difference is clear. I will ask the question. Any day I can ask. Okay,
Okay, ma'am.
very good. Okay, next now we'll move towards what are the types of asthma. Based on the causes and the severity of the symptoms, asthma are intermittent, persistent. Intermittent, with the name itself, we can see that it goes, so it comes and goes. Okay, again it can comes and goes, where anytime it will come and go. So you can feel it is like a episodes of asthma can come. You can feel normal in between. When the problem goes, like sometimes we say, na, yesterday night the person get asthma attack, now it is normal. So person get normal after some times of the attack. But persistent, by the name itself we understand that it is regular or it remains. Persistent asthma means you have symptoms more than the time. You have more symptoms again and again, and for the long period of the time. Okay, symptoms can be mild, moderate, or severe. It depends on the person to person. Okay, but main is intermittent and persistent. Second type of intermittent is for the short period of time, in between you feel normal. But in persistent, it is for long period of the times. Most of the times you feel like that only. Okay, this is more you can say more problematic or more chronic. Understand this one, I think. Now, based on the time of the attack. So seasonal, this asthma is when occurs in a particular season and patient is free from the attack rest of the year. The whole year, no problem is there. But when the person is at the time of maybe summer, at the time of the maybe winter, the person is getting asthmatic attacks. Okay, so on the basis of season and perennial, what where we studied this seasonal, perennial, and all? Someone can tell if remember
Sinusitis.
in
Sinusitis,
in sinusitis.
rhinitis, allergic
Rhinitis.
rhinitis.
Yes, very good. Allergic rhinitis we studied. Okay. So what what about what we talked there? Allergens, huh? Allergens, seasonal allergens are causing this. Okay, like that. Okay, perennial, with the name itself, that throughout the whole year the person is affecting by this problem. Regular, irregular intermission throughout the year. Like irregularly, it is not at the same interval of the time, same problem, not like that. But irregularly at any time it could happen. Seasonally, due to some seasons only. In this time, in winter it is happening. Next time also in winter it is fixed. In winter it will happen. In perennial, throughout the whole year you can have the symptoms. Irregular, you don't know what is the distance and when it will happen. Anytime it can happen or can be okay. Okay, these two types are clear types of asthma on the basis of severity and based on time.
Yes, ma'am.
Okay, very good. Now pathology. Pathology is nothing that how it is happening. I told you before only, but still I'll tell you with the diagram. So inflammation, mucus buildup in the airways, same as in chronic bronchitis, reducing the space available for the air to move, of course. So lungs, asthmatic. I will tell normal asthmatic airways is this. Normal condition is this. The normal place is there, space is there. No narrowing down. Diameter is big. In asthmatic airways, the person normal, I will say that this person is having asthma. Okay, his airways will be like this, a little narrow down. But but if the asthmatic airways during attack, at the time of the attack, what happens? The mucus increases more than normal. If the person is having asthma, we are seeing only these two diagrams. Okay, these two diagrams. Normally, person is having asthma. You will have a little narrow down passage like this. Okay, like this. But in this one, when having attack of the asthma, at that time more mucus will increase, more inflammation will be there, and the passage will decrease, like narrow down, more narrow down. That very less space is there. That less space is enabling accident to come out and out and in. So at that time the very less like very small or narrow passage is there. This is at the time of the attack. Okay, wall inflamed and thickened. Okay, now next in pathology, understand this you should know, this is easy, but you should know that pathology is this. Okay, asthma triggers. How asthma triggers? With what could be the factors that can leads to asthma? Okay, allergens. you correlate everything with, because these are respiratory disorders, correlate with that whatever we have studied. So allergens are causing again irritation and all inflammation, then further the same blockage will happen. Virus infections also, because yesterday we studied that infections are causing the problem. Then drugs, some drugs also can tighten your bronchus walls and can decrease the or narrow down the passage. Then excessive exercise also can lead to that, because it will be exaggeration of your body. Then food, some food items, because there is also, because some food items too much fat, it will take the cholesterol deposition or plaque deposition that will study in heart diseases also happens. So this also can narrow down the passage. Air pollutants, same as similar to allergens. Then stress is the main cause of everything. We'll understand in yogic management how. So stress is the main cause, because stress is at the mental state. Mental state only leads to the physical disbalance. Mental state only leads to physical disbalance. How? In yoga subjects you have studied, must have studied Adi and Vyadi. Yes or
Yes,
no?
ma'am.
Yes,
Yes,
so
ma'am.
Adi and Vyadi. So what is Adi? Adi is a mental status, or Vyadi is something which is
Physical.
physical status. So when Adi, problems at the mental state are there, problems at the mental state are there, it will leads to problem at your physical body, or your annamaya kosh, or your physical body which is visible to you. Okay, that's why when the person is feeling too much stress, high level of this stress, it can lead to fever. Normally, one example I am giving, normally if person is having lots of stress, any problem in the family or some problem to the loving beings, so the person get feverish, or something which is visible on your physical body. So this is how it works. Adi turns to Vyadi. Adi is here stress. Stress is Adi only. Okay, stress is one of the Adi, which is leading to problem at the physical level. Occupational factors, some occupational factors can lead to, then like before also in allergic rhinitis we studied, the occupational allergens are there which can cause inflammation and all. Signs and symptoms, dyspnea and cough, dyspnea and cough, tenacious mucus production, like lots of mucus production in your this your bronchi and bronchus, non-productive cough, high respiratory rate with use of accessory muscles, like your respiratory rate also increase, and also the whole respiratory system or respiratory tract can be affected. Chest tightening, of course, the chest pain is also there.
Excuse me. Can you please explain the second point? How does excess
Tenacious,
mucus? Yeah. Second point, please, ma'am.
yes, tenacious mucus production. One second, I'm just confirming it. Okay. So it is nothing but the too much mucus is there, na, which can cause the chronic respiratory problems. That is tenacious. Like large amount of mucus production will leads to, which is called as tenacious mucus production. Okay, nothing but large amount of
Okay, ma'am. Okay.
the name. It termed is name is the term is named like that. Okay.
Yes, ma'am.
Okay. So now tightness in the chest and also pressure. Okay. This dyspnea, everyone understand? This means that when you have difficulty in breathing, okay, very difficultly you breathe in. Okay, then this is called as dyspnea and the cough. Okay, then shortness in the breath, wheezing sound, of course, when no breath. Now, this term is very important for the this your asthma. Hyper responsiveness. What is, we'll understand with the name itself. Hyper responsiveness. Okay, hyper means high, or matlab, or means very high, or that much not required, even not required, still that much it is showing, that is hyper responsiveness, responding to something. So what a bronchial hyper responsiveness is a currently defined as a increase in sensitivity to wide variety of airway narrowing stimuli. So I will make you understand in simple way. If we'll get some of the allergens, some infections here in the exam in this diagram, you can see this is normal dissection of our bronchi. Then, if some infection is coming, if allergens is coming, very less also, not at the high level, that much should cause the problem because our immune system is not strong. Huh? So even the small thing is affecting at the large level. Okay, so it is responding to such small like allergens or small infections also with high responses it is giving, and in response to it, it will release mucus. Just I told you before only, it will release mucus and try to save the body, and then further blockage will happen. Okay, these are examples like these are stimuli. Okay, these allergens, occupational allergens or occupational problems and infections, these are the normal stimuli which are coming from the environment or something outside from our body. Okay, these these are coming inside our body not at that high much level because our immune system is very weak. So these are reacting, our immune system is hyper responsive for these. It should not be that much responsive, still it is hyper responsive to it, which can further leads to the reactions. Of course, if something is coming, it will give the reaction to it, further in reaction of inflammation, which further leads to vascular changes. Vascular changes means changes in the vessels. Then matrix deposition of some mass, smooth muscle hypertrophy. This in smooth muscle hypertrophy is also the thickening of the hypertrophy here means thickening of the smooth muscles. Then endothelial layer is there, na, thickening of that layer also. Okay, so hyper responsiveness is the term you should remember for asthma. Why asthma happens? Because our immune system, our body is hyper responsive to these external particles or external stimuli which are coming from outside. Okay, this is understand hyper responsiveness or any doubt in this?
No, ma'am.
Okay, very good. So one more term we'll understand, status asthmaticus. Okay, what is this? When it remains for more than 24 hours despite the administration of the bronchodilators. What are bronchodilators? Dilator word itself says that something to increase the diameter. Okay, to increase the diameter. Bronchodilators are the medicines which are given to asthmatic people or those who have narrowed down bronchial tubes. So it is given to them. So with the help of these bronchodilators, the mucous membrane will be released off, and the diameter will increase and narrow down passage will increase, the passage size will increase. Okay, not come to the normal position. So even we are giving them bronchodilators to increase the air passage. Even we are giving them bronchodilators, still it is not working on their body, and the condition is happening like it. Of course, if it is not working, it will goes on for the whole day, 24 hours it is going on. Okay, severe form of asthma, this is exactly a status. The word status means itself, it continues for long period, or it continues for the whole day. Status means continues for the whole day, therefore 24 hours it is there. Even we are giving them medicines like bronchodilators which increases or which decrease the narrow down passage, still it is not working on them. So therefore it is a form of severe asthma in which the airway obstruction is unresponsive to the drug therapy. Even we are giving them drugs or medicines, but our airways or that obstruction is not responding to it. Matlab, it is not our, in simple words, it is saying that drugs are not affecting on our bronchus or bronchial tubes. Can lead
So
to,
does this lead to death, ma'am?
yes, I'm saying that it leads to respiratory failure. Okay, then further can even if it is more severe, can lead to death also. In starting only I said na, in asthma sometimes it happens when person unable to cope. It happens that due to asthmatic attack also person can die. Normal life also we hear na, due to asthma attack sometimes,
Yeah.
because in this condition, what is happening? That tablets are or drugs are also not working, and if drugs are not working, excess mucus is again more and more excess mucus is coming, more and more excess mucus is coming. The complete blockage of the bronchial tubes could happen. If complete blockage, no inhale, no exhale, then can leads to the respiratory failure. If respiratory failure is there, how can we breathe in or exhale out? Okay, understand? Move ahead. Okay, prevention. Keeping the house clean. Because why? Because environmental allergens can also lead to disease. Getting rid of the pets. In starting in rhinitis only, I told you all this. Huh? Avoiding allergic food. Some people are allergic to something, and some other could be allergic to other thing. So you should avoid that, and maintain room temperature. Maintaining your room temperature, because sometimes this too much cool in AC and then further going to the hot, this can affect. And if we are yogic student, we should avoid ACs how much we can. Mm. Causes of asthma. Today I think of completing yogic management also. Okay, two sides. Causes of asthma. We did before only, but we'll see. Okay, allergies. Due to the allergies, having allergies can rise the risk of developing asthma. Of course, if the allergies are there before, in the causes only, in the symptoms only, we do this. Environmental factors are same. Allergens or any pollens or anything which is not suitable for the one's body can lead to, still we'll see. Okay, people can develop asthma from exposure to things that irritating the airways. Something or the other could be not suitable for your body, can cause irritation and then further inflammation, further blockage. Okay, these substances includes allergens, toxins, these external environment factors. These are the examples for the environmental factors. Okay, toxins, fumes, and also pollution. We can add very many things are there. And this smoking, second hand, third hand smoking, these can be especially harmful to the infant, students, and children. Why? Because the main base I told you on the first day, that immune system, their immune system is not completely developed. Not for them only, even at the old age their immune system get very weak. Okay, so they can also have the high risk of asthma. So main cause is again immune system. Okay, last is medical management, bronchodilators, nebulization, and inhalers. So bronchodilation, before only I told you that medicines or drugs which are given to dilate, to increase this increase the size of not to increase the size of bronchial tubes, but to release that inflammation and the mucous membrane to become the normal size. Okay, bronchodilators are given for that purpose. Nebulization, that is medicines through the these nebulizers, this one. Okay, through nebulizers we are giving medicines. And then inhalers, also in normal day-to-day life we use inhalers. Okay, medical management we used to like that, do like that. Further we'll go for any problem in this, any doubt in this, then we'll go for yogic management. We have to complete the respiratory disorders today.
No
Any
doubt.
doubt?
No doubts.
Okay.
And in the previous slide, there was also genetics, and there was some other point.
Yes, okay. Genetics, the genetic problem is when genetically your parents if having, it could transfer to you also. And then I didn't see this. And if someone in the family will have the problem, can develop. And also respiratory infections like flu, pneumonia, etc., can also leads to this one disease. Or next, yogic management last. Okay. This is yogic management of all the respiratory disorders. Hmm. All together for, because understand, because in the respiratory disorders your whole respiratory system is attacking. What are the respiratory system? The trachea, lungs, and all bronchi branches till alveoli, your nostrils and passage, all this is involved. So the same thing is happening. The main problem is, what is main problem? That any inhalation is and exhalation is not happening properly due to some or the other reason. Okay, so for that purpose we'll have to manage the problems for that purpose. The same thing or same yogic management we can give for all these, for respiratory disorders. Okay, because it the same asanas will affect on the same region of the body, and the same region is affecting. Okay, so as I told you in starting, what is the integrated approach of yoga therapy? Can anyone tell? In first class, very first class, I told.
which addresses Annamaya Kosha, all the five koshas,
Yes, very good.
Panchakoshas.
When we treat the disease with including all the panchkoshas, when we work on all the five koshas, it is called as integrated approach of yoga therapy. So now we'll go with that only. So like in first we'll go with Annamaya Kosh, Pranmaya, Manomaya, Vigyanmaya, Anandamaya, as it goes. Okay. So at Annamaya Kosh, what is Annamaya Kosh? It is physical body which is visible to us as we are seeing each other. That is only the Annamaya Kosh. So what we have to do with the only koshas which is visible, no, na, only kosha which is visible to us. So in Annamaya Kosha, definitely how we can by your mind itself you can understand how we can serve our physical body with the diet, with some exercise practices. Everything is at the basis of Annamaya Kosha, na? So we'll first of all see into the diet. Diet, normal sattvic food you should take, not like all the packet foods, all these like deep fried foods that can further leads to again this deposition of the cholesterol or deposition of this mucous membrane, and can cause the problem. So simple sattvic vegetarian food you should take, which will build up your immunity, and the immunity is the main cause for the disease. Okay, because low immunity is only releasing the histamine. Also no immunity is only unable to cope up with the external stimuli. Okay, so simple sattvic food, no packet foods, no deep fried foods. Okay, kapha reducing diet in asthma. So what are the kapha reducing diet? You have studied the Ayurveda?
No, ma'am.
Not yet, ma'am.
Okay. Okay, so then this I will explain you at the last. We'll complete the yogic management. After that, I will show you that. Okay, I'll make you understand here only. So there are six rasas. You will understand: Madhur, Amal, Lavan, Katu, Tikt, Kashay. Okay, Madhur, Amal, Lavan, Katu, Tikt, Kashay. Madhur is sweet. Amal is the taste of this. What shall
Sour.
Amla,
Sour.
Amla, gooseberries. ठीक है मधुर अम्ल अम्ल is that only na. Lavan is
Yes, ma'am.
lavan is salty. Okay, lavan is katu is some. This is very confusing. People think that katu is
Ma'am, it's astringent. That is what they say. Pungent.
pungent. Is
Pungent.
pungent is kashay. Kashay is pungent. Actually,
Kashaya is astringent, I think. Katu is pungent.
no. Katu is actually thick is spicy, and katu is this one.
Bitter.
Tikha,
Yeah,
like
bitter taste.
mirchi, huh? Bitter.
Katu is bitter, it seems.
No, katu is not bitter. That is the confusion. Bitter means you say Karela. Huh?
Yeah, bitter.
No. That is the only confusion. In Ayurveda, it is different. Katu is your because in some languages, one of my friend is there. So in their like she's senior in their language Assamese, they used to call katu that only. This one spicy.
Spicy.
Spicy. Okay, so from in their language, according to them, it is right, है ना? But we understand that katu is a kadwa or something like bitter Karela taste. Huh? No, so always remember this is a great confusion to the student. Okay, in starting I also have this confusion. That's why especially I'm telling you this one. Okay, katu is always katu by the name. It seems like kadwa or it will be bitter, but it is not. Okay, it is spicy and thick is bitter. Okay, please remember. Hmm. Madhur, or we did. Kashaya is this pungent. Okay. So astringent or something like acidic foods we have na. Then these is kashaya taste. What with amla is kashaya only, na? I think amla is kashaya only. The taste we have. Amla. Okay.
Amla is little sour and it's mixture of the both.
That is that taste only we used to call it kashaya, na?
Ma'am, Manojji has done his naturopathy.
So shall we
So
tell?
he knows about it.
So shall tell. Kashaya is astringent, na? Astringent or
Is he there? I'm not sure.
Kasha, ma'am, Katu, I feel it is astringent and Kashaya is pungent.
kashaya is
I,
pungent. And amala?
Amala is sour in nature.
Okay. And lavan? Salty.
Lavan is salty.
Yes. Okay. So this Madhur Amla Lavana, we used to give in this. It increases the vata and decreases your kapha. Okay, decreases your kapha. Sorry, increases the cough and decreases the vata. Okay, am I right, sir? Increases the cough and decreases the Madhur Amla Lavana, increase cough and decrease vata. Though these three,
Correct. Ma'am.
yes, in these three, this will decrease the cough and increase the vata. Okay, increase the vata. So as we need to give kapha reducing. So for kapha reducing, we'll give them this katu tikt kashaya. Okay, this only I want to make you explain. Okay.
Okay,
So
ma'am.
kapha reducing diet, what exactly means is a katu tikt kashaya you have to give them. Okay, I will write in the bracket also while sharing the slides. Okay, then we'll go for these loosening practices. This is also in the Annamaya Kosha only. Loosening practices like normal loosening of the joints, stretching, breathing practices, and chair breathing. Chair breathing while sitting on the chair, we used to give them practices. Okay, back bends and twisting, all that. Main will go for asanas. So Ardha Chakrasana. Ardha Chakrasana is standing posture. Everyone know about these asanas? I am making you study like you are yogic student like that. If any problem, you can come.
Yes, sir.
Ardha
Ma'am.
Chakra, you are knowing na Ardha Chakrasana. In Ardha Chakrasana, we are bending backward, so it will affect the throat region, or this it will expand our chest region, so it will be beneficial for us. With breathing, if we'll do the practice, then only that blockage will release out. So very important in this is this one pranayam practice, but still asanas are also very important along with breathing. If we are not doing with breathing, the practices will not affect us that much as it should be. With breathing, it will give complete 99%. Okay. Then Shashankasan, you are going forward. Then it is again stimulating your this part. Padhastasan, forward bending. These are all Ushtrasana, again the expansion of the chest and all. Ardha Matsyendrasana, in while twisting, it is affecting your this lungs region and your throat. Twisting of your throat is also there. Okay. Bhujangasana, again expansion of your chest and it will activate your upper region. Dhanurasana, same practice. All the backward bendings will expand your chest. Hand in and out breathing also we used to do in standing. Okay, that we do, hands in the front and sideways, raising hands sideways, expanding your chest. That the same Matsyasana, while fish pose, while lying down from the supine position, we used to do. No? Then Setu Bandhasana again. All these asanas you will know all the I will take the main aim. All the there could be more asanas, okay, which we can do, not only exact like this only. These are main common, which are very main important. Okay, so other asanas also, whichever asana which is in expanding our chest, and affecting to our throat and upper head region along with our chest will be included in this. Okay, then Kriya.
Ma'am, uh, how
Yeah.
forward bending asana helps in respiratory system
Because again,
to express.
because again you see we are doing chin lock, or again we like it will stimulate these organs and these hormones. Again it will affect it. That is not that only these asanas, it will do other asanas also, it will affect us, but these are the main asanas. Forward bending also will do chin lock or will go forward, our chest will again be pressed it will again stimulate it and relax it. We can't do all the backward asanas all together na? We have to go for forward also.
Counter pose is also
It,
yes, ma'am. Yes.
it is required, and it will affect it. Okay, because it will again stimulate some or the other, how it is stimulating na. So Kriya now, Neti is very because allergic rhinitis as well. Knowing allergic rhinitis, it is affecting your nostrils, because in the nostril we'll used to go for Neti. Neti is you can go for Sut Neti, Rubber Neti, Jal Neti. First of all, go with Jal Neti. Okay, normal Jal Neti, because that hot water will release your mucus again and again daily. If you will do, it will help you. And in real life, I have experienced that it helps very much. Avoid after if you had the surgery in your nostril or that reason of the respiratory tract, any reason in the respiratory tract, avoid this. Neti is better in the dry nose. Okay, but still we can do no, not like that. If it is not dry, if it is not good, you can put this one. If it is difficult for the people to do daily, we can put oiling nastya, we used to say na, oiling in the nostril at the night, and then do it. It will be happen as good it didn't happen before. Okay, dugdha neti, neti with dugdha neti, you everyone know, neti with milk is better in allergic rhinitis. Okay, many types of neti we do, ghrith neti, dugdha neti, and with other different medicated waters also. Okay, depending on the condition. Then dhoti, it is not necessary. Leave this. If someone can do dhoti, this is very good. Why? Because the whole respiratory tract will involve in this. The whole cough will be released out. If you are unable to even engulf the dhoti, still if you will try, you will see that lots of cough is coming out in that only. So something is releasing now. That's why it is good. Hmm. You can even just trial also will affect you. Okay. In Kapalbhati is definitely is the main, something which is said main to remove all the 25 of kapha doshas, to release all the 25 of kapha doshas. So Kapalbhati is very good practice. You should go for that. Then Shankh Prakshalan, complete cleansing of your body. Then further it will also uh, because warm water we are taking na. And then we'll move towards next kosha, that is pranamaya kosha. Vibhagya pranayam, that is sectional breathing. Hindi name is Vibhagya pranayam. Sectional breathing, in sectional breathing what happens? Someone knows sectional breathing here?
Yes,
If I'm
ma'am.
not wrong, section B is thoracic breathing and
Yes,
abdominal breathing,
yes,
kind of.
yes. So this sectional breathing is divided into three parts. Okay, 1, 2, and 3. Sorry, it is very difficult to write this. Okay, so upper region, upper body, thoracic. Sorry, one is thoracic. This one is clavicular region. Okay, clavicular region. This is thoracic region, chest region, and this lower part is abdominal region. Okay, it is divided into three parts. So first go for how we should do. I'm telling you about the practical. So first go for abdominal breathing. Only inhale. With inhalation, bulge your abdomen. No need to bulge. Just inhale and exhale. Just your whole awareness should be on this abdomen. Okay, though it is going in the whole pathway, but your awareness is on abdomen, so it is called as abdominal breathing, because you will feel that only I am working on the abdomen. Everything comes from the mind, I told you na, from the brain, from the mind only. Okay, so when we are our awareness is on abdomen, we'll think that it will be abdominal breathing. Then thoracic breathing, chest region part of by doing this thoracic breathing. Of course, when you are inhaling, okay, just remember, see, when you are inhaling, here is lots of that all inflammation, mucus and all. When you will inhale slowly with awareness, okay, normally we are inhaling like without awareness, but slowly you are inhaling with awareness, definitely this cough, this mucus will going to be released slowly and slowly with the long practice. Okay, so this is how the mucus will release and it will decrease. And person really, with if you you will see some patients, they get rid of the complete rid of this problem. Okay, therefore I said na, medical maybe medical condition, medical management don't have the complete cure of the disease, but if we did with complete determination and with our best long term practice, this yogic management gives. You have any class after this? Only last,
Yeah.
No,
only
ma'am.
Yeah,
last
this
slide
is the
after this.
last one. But the class tomorrow begins at 4:30, ma'am. So you have to let us go
No,
early.
only last slide. After this, last slide is there. Only Anandamay Kosh Anandamay. ठीक है. Nadi Shodhan pranayam, again normal Anulom Vilom also we used to call it Nadi Shodhan. Ujjayi for Ujjayi everyone knows है ना. For the throat of course the cough will release and it will affect whole bronchial tubes, bronchial trachea, etc. Okay. Then Brahmari, why Brahmari? Because Brahmari will create the vibrations. These vibrations also help in releasing the cough or these problems, all deposits. Okay. Then Manomay Kosh will go. Manomay Kosh at the mental level. So mental level will go dharna, dhyan, and meditation. Especially is meditations. Okay, we'll have to go for meditation. Meditation. If you don't know any meditation, no problem. Just close your eyes, sit down, and concentrate on your breathing. Just start from 2 minutes, 3, 4, 10, as you have time and as you can do. Okay. Then last, very last slide. Okay. This is a Vigyanamay Kosh. Vigyanamay Kosh, something which is related to intellect or mind. Sorry, is something which is related to your buddhi or intellect. So the lectures, what lectures? The yogic counseling we should give them. This is very last slide. So just 2 minutes give me. Okay. This is a lectures. How, what type of lectures? Yogic counseling we can give them. Okay. Awareness programs, that what is exactly your disease. We can teach them. If the person is having diabetes, we can teach them that in your problem the insulin is not releasing from the pancreas. And when we are giving them practice like Ardha Matsyendrasan, very good practice for diabetes, we'll tell them while doing the practice, close your eyes and observe that your insulin is drop by drop insulin is releasing from the pancreas. This is how the, if person works on the mental status and understanding the things, things will really happening inside the body. Okay. So awareness programs we can get. What awareness programs? That yes, there is the cure of your disease. Okay, like that we can have the camps also, and lectures on their problems and the cure of the problems. Also yogic counseling we can do to them, that yes, yoga can uh, release your problem. Okay, then Anandmay Kosh. Anandmay Kosh is happy assembly. At this Vyasa, we used to have happy assembly in which we used to even make people involved in the games and all the activities, because sometimes the person is suffering from the problem, they like get too much stress that I am only the ill, I am only having problem. If he will have the people around him, they are also having problems and they are all enjoying, it will affect on their Anandmay Kosha and will further like make their Manomay Kosha balance, and the problem will definitely going to be okay. Okay, so Anandmay Kosha also need to be worked. Okay, Karma Yoga, like all the activities, and we should tell them about the Karma Yoga. There we used to do all the like farming and all these simple small activities, so that their mind will get relaxed. The main cause is again Manomay Kosha. So we are also working on to make our Manomay Kosha better. Okay, to get all the problems rid of. Okay, thank you so much to everyone. Any doubt you can ask. Otherwise, we'll end here. Only just revise all. Everyone, please revise whatever you have studied today.
Yes, ma'am.
Tomorrow, definitely, I
Thank
will
you,
ask you
ma'am.
to ask the questions. Please don't
Okay,
say,
ma'am.
if you are seeing before this one, what, before recordings, just go through with today's revision at least. Afterward, go for the before recordings. Okay. Yeah, this
Okay, ma'am.
Geeta ma'am and Sangeeta ma'am. Geeta and Sangeeta ma'am. Okay.
Sure.
Sure, ma'am. Sure.
For revise today's, then we go for before recordings. You will have time. Okay, thank you so much to everyone. Hari Om.
Thank you, everyone.